Hi, friends, welcome to my YouTube channel Nursing Classes, a place where you get nursing competitive exam MCQ and theory classes. आज की इस वीडियो क्लास में हम वेस्टर्न कोलफील्ड्स लिमिटेड स्टाफ नर्स एग्जाम 2019 का क्वेश्चन सॉल्व करने जा रहे हैं। शुरू करने से पहले अगर आप लोगों ने मेरी YouTube चैनल को सब्सक्राइब नहीं किया है तो सब्सक्राइब करें और बेल आइकॉन को क्लिक करें जिससे मेरे आने वाली वीडियोस का नोटिफिकेशन पहले मिलेगा। अगर पिछले वीडियोस नहीं देखा है तो प्लेलिस्ट में जाकर देख सकते हैं और वीडियोस के डिस्क्रिप्शन में भी लिंक प्रोवाइड करवा दूंगा। अगर व्हाट्सएप में वीडियोस का लिंक चाहिए तो पर्सनली व्हाट्सएप मी, माय व्हाट्सएप नंबर इन डिस्क्रिप्शन बॉक्स। अगर वीडियो अच्छी लगी तो एक लाइक कर देना और अपने दोस्तों के साथ शेयर करना। चलो अब शुरू करते हैं। एक color coding for nitrous oxide cylinder is A. Black, B. Black with white shoulder, C. Blue, D. Gray. Correct answer C. Blue. 2. Tonicity of ringer lactate is A. Hypertonic, B. Hypertonic, C. Isotonic, D. None of the above. Correct answer C. Isotonic. 03. Sharp instruments should not be sterilized by A. Autoclaving, B. Boiling, C. Hot air oven, D. Antiseptic solution. Correct answer B. Boiling. 4. For nasogastric intubation, the length of nasogastric tube should be measured from A. Nose to sternum, B. Nose to umbilicus, C. Nose to the tragus of the ear plus nose to the umbilicus, D. Nose to tragus and tragus to the umbilicus. Correct answer A. Nose to sternum. 5. A patient is to receive 2000 milliliters of IV fluid in 12 hours. The drop factor is 10 GTT. At how many drops should the flow rate be set? A. 22 drops, B. 24 drops, C. 26 drops, D. 28 drops. Correct answer D. 28 drops. 6. Endoscopic catheters are sterilized by A. Autoclaving, B. Hot air oven, C. 2% glutaraldehyde, D. Boiling. Correct answer C. Glutaraldehyde. 7. Blood vessels which connect artery and vein. A. Venule, B. Arteriole, C. Capillary, D. Sinus. Correct answer C. Capillary. 8. The technique of administering BCG vaccine is A. Z-drug injection, B. Intravenous injection, C. Subcutaneous injection, D. Intradermal scratch injection. Correct answer D. Intradermal scratch injection. 9. During ABG analysis, blood is collected from A. Artery, B. Vein, C. Capillary, D. Any site. Correct answer A. Artery. Thus, which of the following medication order is immediately and once only administered? A. PRN order, B. Stat order, C. Single order, D. Standing order. Correct answer B. Stat order. 11. For intramuscular injection, the nurse should insert the needle into the muscle at an angle of A. 15 degrees, B. 30 degrees, C. 45 degrees, D. 90 degrees. Correct answer D. 90 degrees. 12. Equipment used in examination of ear is A. Laryngoscope, B. Ophthalmoscope, C. Otoscope, D. Practoscope. Correct answer C. Otoscope. 13. The size of intravenous cannula for neonate is A. 18 G, B. 20 G, C. 22 G, D. 24 G. Correct answer D. 24 G. 14. Which of the following is used to assess the level of consciousness? A. Apgar score, B. Braden scale, C. Glasgow scale, D. Snellen's chart. Correct answer C. Glasgow scale. 15. When should rehabilitation start? A. The day before discharge, B. When the patient desires, C. Upon admission, D. 24 hours after discharge. Correct answer C. Upon admission. 16. Bleeding from nose is known as A. Epistaxis, B. Hemoptysis, C. Hematmesis, D. Hematuria. Correct answer A. Epistaxis. 17. The solution used to disinfect bed linen of HIV. A. Dettol, B. Lysol, C. Savlon, D. Sodium hypochlorite. Correct answer D. Sodium hypochlorite. 18. Which one of the chronic condition contraindicates the use of ice sprained ankle? A. Gastritis, B. Diabetes, C. Glaucoma, D. Osteoporosis. Correct answer D. Osteoporosis. 19. Which of the following position would be the best aid breathing for a patient with acute pulmonary edema? A. Lying flat in bed, B. Left side lying position, C. High Fowler's position, D. Semi Fowler's position. Correct answer C. High Fowler's position. B's. McBurney's point is located in which following quadrant of abdomen? A. Left upper, B. Left lower, C. Right upper, D. Right lower. Correct answer D. Right lower. 21. Glycosylated hemoglobin test means glucose level. A. Over 2 days, B. Over 14 days, C. Over 30 days, D. Over 90 days. Correct answer D. Over 90 days. 22. A nurse is directed to administer hypertonic intravenous solution to a patient. She should use A. 0.45% NaCl, B. 0.9 NaCl, C. 5% dextrose, D. Dextrose with normal saline. करेक्ट आंसर ए 0.45% NaCl. 23. Spinal anesthesia is given level of A. L2 L4, B. L3 L4, C. L5 L6, D. L1 L2. Correct answer B. L3 L4. 24. In a patient with multiple small renal color positive patient is the nurse will instruct the patient A. To stain all urine. B. To take plenty of fluid and ambulate. C. To remain on bed rest. D. Ask for medication to relax. Correct answer B. To take plenty of fluid and ambulate. 25. A patient is given atropine sulfate, a premedication before surgery, and develops tachycardia and dry mouth. A. This is a drug allergy. B. Needs higher dose of atropine sulfate. C. Normal side effect of atropine sulfate. D. Patient is anxious. Correct answer C. Normal side effect of atropine sulfate. कैसी लगी यह वीडियो कमेंट करके बताएं। अगर अच्छी लगी तो अपनी दोस्तों के साथ शेयर करना। And don't forget to subscribe. Thanks for watching. See you in next videos.